Do right. Right. Correct. Mute ಮಾಡಿದೆ. Good evening, friends. I'm Dr. Sharath Kumar. I'm very happy to be at Indus Valley Ayurvedic Center. This afternoon, I'm going to give a lecture on natural techniques to solve the erectile dysfunction, which includes natural methods and Ayurvedic medicines, herbal medicines, and other techniques which doesn't directly involve the medicines. So, mute, where are they? I request all the other persons to kindly mute. So today's topic is erectile dysfunction management by natural methods. I'm going to cover this under the following chapters: introduction, definition, causes, risk factors, investigations, general treatment, psychosexual therapy, alternative treatment, natural remedies, which includes Ayurvedic medicines, and carry home message. These are the chapters I'm going to cover. This one. Every one of you know what erectile dysfunction is. Erectile dysfunction can occur to any person, but we define the erectile dysfunction as recurrent inability to achieve an erection, inability to maintain an adequate erection, or noticeable decrease in the erectile rigidity. So all these three factors come to the picture as far as the ED is concerned. Once in a way, if somebody gets no erection, it doesn't come under the definition of ED. To define ED, it should be recurrent. That is, it should be always, or most of the times, or more than 50% of the times. And erection could be there, but it could be inadequate. Then also we call it as erectile dysfunction. So these are the parameters to tell whether a person is suffering from ED or not. And this ED can occur during a partner sexual activity or during masturbation also. If a person is unable to attain the erection during masturbation also, it is considered as ED. So what are the criteria to tell a person has got ED or not? Before any diagnosis of ED is made, the following must be considered. Partner factors. Partner sexual problem or health issue should be considered. For example, if the partner is not cooperative, then if a person is unable to get the erection with that partner, it is quite common, quite natural, because the partner is not cooperating, or she has got health issues. If the partner has got, say, for example, severe cancer or severe TB, one may not get a move or desire and get the erection with her. So partner factors are important. Relationship factor, communication problems, different levels of communication for sexual activity, partner violence. These are all the relationship factors. Individual vulnerability factors, history of sexual or emotional abuse, existing psychiatric conditions such as depression or stressor should be considered. Cultural or religious factor, inhibitions or conflicted attitudes. For example, if the lady has got menstrual cycle, many of the religions doesn't allow during the menstrual cycle to have the sex. So that becomes a religious factor. Medical factors, existing medical conditions or effects of drugs or medications can also cause ED. What are the common causes of erectile dysfunctions? Heart diseases, clogged blood vessels, that is due to atherosclerosis, high cholesterol, high blood pressure, diabetes, obesity. I request all the audience to mute their computers or the mobiles because it is going to disturb me. Kindly mute yourselves. So metabolic syndromes, just like blood pressure, high insulin levels, body fat around the waist, high cholesterol, Parkinson's disease, multiple sclerosis, certain prescription medications. Dissolve others to use the mic by your dissolve them. Certain prescription medicines, Peyronie's disease, sleep disorders, mental health issues, anxiety, prostate cancer, surgeries, low testosterone. So these are all the common causes for ED. There are certain risk factors for the ED also. Aging. As the age advances, the erection comes down. Sedentary life, no activity, that also results in ED. Heavy smoking, use of tobacco, all heavy alcoholism, substance abuse, drug abuse, partner problem, all these are risk. History itself says that the person has come for ED. No need of any diagnostic tools once the person says that I am not getting any adequate erection. Physical examination to rule out the penile problems. Blood and urine examination routine to rule out diabetes, cholesterol. Hormone tests to rule out hypogonadism, low testosterone level. Genital scanning to rule out Peyronie's disease, fibrosis. Color Doppler penis to know the blood circulation into the penis, venous incompetence, arterial insufficiency. Other tests if required. So these are the diagnostic tools available to differentiate what type of the erectile dysfunction the person has got. As far as the ED is concerned, the person himself comes and says that I have got ED. So diagnostic tools are required to know the type of ED, causative factor for the ED. Treatment. So there are several options for the treatment of ED: lifestyle modifications, psychosexual therapy, medicines, injections, vacuum pump device, other treatments, herbal treatments, and surgery. I'm not going to cover the injections and medicines and surgery in this lecture. I'm going to concentrate only on the natural methods. So coming to lifestyle modification, it's very, very important to modify the lifestyle as far as the treatment of ED is concerned. Lifestyle modification itself may control or bring lot of remedy for the ED. In fact, it may sometimes cure the ED also. Quit smoking, limit the alcohol, stop the drug abuse, manage the weight, keep the weight within the permissible body mass index, that is between 20 and 25. Create a healthy sleep routine. That is very, very important. Managing sleep apnea, yoga, meditation, regular exercise, healthy food. So these are all the changes one has to adopt to see that the ED comes to control. So without any medication, by adopting these lifestyle modification, one can get lot of relief from the erectile dysfunction. Nutritional supplements: L-arginine, L-citrulline, propionyl, L-carnitine, flavonoids, zinc, vitamin D, folic acid, L-methylfolate, DHEA. So all the vegetables and fruits which are rich in these nutritional supplements are going to directly or indirectly help the person to overcome the ED. So nutritional supplement going through the chart is very, very important. Modifying these, adopting these nutritional supplements in your daily lifestyle and daily eating habits makes you to get rid of the ED within 1 to 3 months. You cannot expect overnight result by nutritional supplements because these are all the modifications which are going to occur inside the body. So you don't get just like taking one zinc tablet, you don't get any erection at all. It requires long-term treatment. Herbal products. Several herbal products have been tried all over the world, and to some extent, people are successful in getting the erectile dysfunction controlled or relieved or cured by using these herbal products. Some of them are Hygrophila spinosa, Bokshara, Ginkgo biloba, Ginseng, Ashwagandha, Shatavari, Safed Masli, Tulsi Beej. So these are some of the herbal products which have been tried all over the world, and several papers are available for and against these products. So I will go kindly mute. These are others too. You have options, as a Shatavari. Shatavari, it's also called as curer of 100 diseases. That is, Shata means 100 in Sanskrit. That is, the Shatavari is said to cure hundreds of diseases. The botanical name is Asparagus racemosus. It is a root. It is used in many Ayurvedic preparations, Ayurvedic Vajikarana mixtures. It is meant to improve sexual function and health. So Shatavari, in fact, any Ayurvedic preparation, proprietary preparation for aphrodisiac use or for erectile dysfunction or for increasing the semen quality and quantity, you can see Shatavari is included as one of the ingredients. Safed musli or white musli is widely grown white colored herb is often referred to as white gold or Divya Aushadha. Divya Aushadha means some divine medicine. White gold means it is gold equivalent to gold like. Safed masli is used popularly to improve sexual performance and general overall health both in men and women. Safed masli helps manage ED as well as stress induced sexual problems. It also helps to improve the quality as well as quantity of sperm due to its spermatogenic, anti-stress, and antioxidant properties. So, friends, any or most of the Ayurvedic preparation does contain some or the little quantity of Safed Masli because of its good effect on the sexual functions. Tulsi, also known as holy vessel, holy because it is being worshipped by Hindu women and Hindu people as say equivalent to something like a god. It's an herb that is commonly found in Indian households and is said to have many health benefits, including improving sexual health and treating male impotence also. Tulsi seeds are also said to have relaxing and numbing properties that can help and prevent premature ejaculation also. L-arginine. L-arginine is an amino acid which is building block of protein. It's a vasodilator, meaning that it can help open up the blood vessels. In theory, this could increase the blood flow to the penis and help to produce an erection. A study reported that many people with TD had L-arginine levels, low L-arginine levels, which suggest that it may be linked with ED. However, scientific studies have not proven that taking L-arginine supplement can treat ED. There are several papers which say that L-arginine is useful. Several papers says that no, it is not useful. However, most of these food supplement sachets which are available in the market for the treatment of erectile dysfunction does contain 2 to 3 grams, even up to 5 grams of L-arginine in their sachet. Because of its vasodilatation effect, it may be useful for the treatment of feeding. There are several side effects which I am going to tell in the end of all these things. Many people think that there are no side effects with the Ayurvedic preparations or herbal preparations or Unani preparations. It is not true. Anything and everything which has been taken to the body may have side effect because side effect is nothing but interaction between the body tissue and the external agent you would have given. That external agent need not be a tablet. It could be any root or bark or leaf of a tree or even a shrub or an herb. So it can interact with the body and it can change the body function. And there could be side effects like nausea, stomach cramps, decreased blood pressure, and increased blood sugar level. So all these are possible with these herbal preparations also. The next one is propinolol L-carnitine. A study has said that diabetes is found that taking propranolol L-carnitine alongside the sildenafil could improve the ED function better than taking sildenafil alone. That is, we give several times along with the Viagra tablet, that is sildenafil citrate, many adjuvants. One of the adjuvants is propranolol L-carnitine. Studies are shown needed for to actually to know the safety and efficacy of this treatment. Side effects, as usual with any other medicine, skin rash, nausea, diarrhea, heartburn. It may not be safe for the people with vascular diseases, high BP, diabetes, and liver cirrhosis for taking this propionyl L-carnitine. Another food supplement is DHEA, dehydroepiandrosterone. It helps to create sex hormones, including testosterone and estrogen. In fact, DHEA is the precursor for testosterone and estrogen. Natural DHEA levels decrease as person gets old, which causes ED. Some studies suggest that DHEA supplement could be a treatment for ED. Others found that no evidence. Most of the scientific studies which we get and which we see in the Cochrane review, several studies will say that yes, this medicine or this herb or this leaf is very useful. There will be equal number of papers which say that no, it is not that helpful. So you have to take with a pinch of salt. If the studies glorify a leaf or a herb or a shrub or a bark or a root, just go through the literature completely and see whether it is a sponsored program from any company. Usually, sponsored programs will glorify the positive effects of any herb or shrub. A neutral double-blind control studies with Cochrane review gives the correct report. So we have to take with a pinch of salt all these studies. DHA generally causes few side effects. It includes fatigue, headache, acne, and irregular heartbeat. Ginkgo biloba is another very popular medicine, a herb, which may increase the blood flow to the penis, which improves the ED as well as desire. Several studies state that no solid evidence is there. Side effects include dizziness, stomach upset, palpitation, and constipation. It can also increase the risk of bleeding and may be dangerous for people taking blood thinners like warfarin and even ecosprin like other medicines. And it is contraindicated for the men who have got bleeding disorders. Ginseng is another very popular home remedy. It contains chemicals that this plant, that is Panax ginseng, it may promote relaxation of the body's smooth muscle, helping produce an erection. A study suggested that ginseng berry extract could help treat the mild ED. The recent studies conclude that ginseng might only have trivial effect on erection. So most of these adjuncts, that is herbs or barks of the trees or roots or leaves, they may at the most help for the other treatments to act in a better way rather than giving the direct effect of erection. Most common side effect of the ginseng is insomnia. Yohimbine is another tree's bark which is seen in the Africa. It is a traditional aphrodisiac. African men are using yohimbine, that is a tree bark, from very long time as an aphrodisiac. Several studies report that there is not enough evidence that yohimbine from tree bark can treat ED. However, popularly being it is being used, and many men do get benefit out of the yohimbine. Yohimbine hydrochloride, different form of yohimbine, is available as prescription drug ED. This is a different product than dietary supplements made from the tree bark. So you have to differentiate the two. Yohimbine, which is natural substance, is a tree bark from African tree, is different from the tablet which you give in the counter with prescription, that is yohimbine hydrochloride. It's a synthetic medicine. Same thing like just like cinchona. When the cinchona bark for the malaria, they extract and then they synthesize and give the tablet in the medicine in the tablet form. So yohimbine is available as a tablet in yohimbine hydrochloride form. Studies link yohimbine with serious side effects such as heart attack and seizures and stomach problems, anxiety, and increased BP. Another herbal medicine which is available is horny goat weed. Epimedium grandiflorum is the botanical name. It's also known as horny goat weed, traditional remedy for increasing the fertility. A study found that active component of horny goat weed is icarin, may have positive effect if treating ED cause for nerve injury. Researchers conducted this study on grown nerve cells on rats and on the injured nerves and found some good results. This supplement is often well tolerated. The side effects include nausea and abdominal discomfort. Another herb, Hygrophila spinosa. Hygrophila spinosa is a wild herb that mostly grows in moist places like banks of tanks, ditches, paddy fields and is commonly known as Talikamana or Kokelaksha. The plant has been used since ancient times for the treatment of pain, jaundice, malaria, as well as an aphrodisiac. Another very popular herb is Gokshura, Tribulus terrestris. Gokshura, also known as Tribulus terrestris, is a tiny leafy Ayurvedic herb that belongs to the community of caltrop family. It is a vital element used to treat ED, urinary diseases, PCOD, prostatic problems, heart ailments, and kidney problems. It may also aid in the development of muscle growth, increased and cognitive activity. So this is how tribulus terrestris work. It increases the erectile function. It increases the female functions also. It increases the number of follicles in the woman, and it acts on the sperm parameters also. It increases the sperm count and motility also, and it also acts on the sex hormones, increases the testosterone, and in women increases the estrogen and DHEA. Ashwagandha, it is a very, very popular Ayurvedic medicine. It is considered as aphrodisiac or herb used to improve the sexual desire, pleasure, or performance. However, scientific research doesn't say that herb used for ED. It may be effective for low libido. Ashwagandha also has been used in traditional medicine for insomnia. It is an evergreen shrub with some medicinal property, while some people may recommend it for ED also. But there is no certain current evidence to prove that ashwagandha acts on the ED. And it reports suggest that herb may help person with ED. People likely base this assumption or research that shows ashwagandha improves the testosterone level. Coming to non-medical methods of treatment by natural techniques, it includes psychosexual counseling and therapy. For men with stress-related ED, when the partner is involved in the treatment, the success rate for the treatment of ED is 50 to 70% with psychosexual counseling only. By psychotherapy itself, we can relieve about 50% of the EDs, especially when it is related with a partner-related ED. When the man must go through the counseling alone, the results are less successful. So for ED, when they go for the counseling, it is better the couple goes so that they get the maximum benefit. Psychosexual counseling is unlikely to be effective if a man drops out of the treatment. So psychosexual requires at least 3 to 6 sessions. Overnight results cannot be established by psychosexual counseling and treatment. Yoga nowadays, from past 1 decade, it has become very popular and it is being practiced all over the world. The benefits of yoga people are experiencing. Hundreds of literature and papers have been published from even the Western world, in the European world also, as far as the yoga and its beneficial effects on general health is concerned. And of course, on the sexual health also. Yoga is a practice that focuses on bringing the balance, harmony between mind and body. The erectile dysfunction is a psychosexual disorder. There is psychological factor also. In fact, most of the erectile dysfunction, 40 to 60% of the causative factor is the psychological factor. By bringing the body and mind together in an harmony, you can tackle the psychological factor. And if the psychological factor is overcome, that itself will be a treatment for the ED. And the yoga originated in India about 5,000 years back, and it is being practiced in India ever since the 5,000 years. People think that doing asanas is the yoga. Absolutely no. Asanas are part of the yoga. In yoga, there are several methods. It's a way of life itself. It includes not only the asanas which will be equivalent to exercise, what you call. It also includes meditation, and chakras, mudras, and pranayama, the method of breathing, method of taking good air, and controlling the mind by Tratika, and controlling the body by several techniques that is called as asanas. And these asanas are done with along with breathing, controlling the breathing, so that the effect of these asanas are many times increased. It shows that it helps enhances the health and mental well-being. Benefits of this ancient practice have helped to popular even in the Western culture nowadays. Today, many people practice yoga recreationally as a form of exercise and relaxation. It's also used effectively in mind and body medical interventions for certain conditions, including erectile dysfunction, anxiety, post traumatic stress disorders, pain disorders, and cancer therapy. Sensate focus therapy. This is being practiced from 1971, and it has also been described as mindful touching or non-arousal focused touch. Sensate focus therapy especially helps the couple to overcome the ED. The sex therapist may recommend sensate focus to couples who want to address problems related to body image, arousal, desire disorders, orgasm disorders, premature ejaculation, and erectile dysfunction. Body massage. Nowadays, body massage is becoming more and more popular. There is still hope because basic massage techniques may enhance the blood flow and relaxation to important aspects of treating any body pain. How body massage helps is because while massaging, the blood supply to the muscles, ligaments, and joints increase. Thereby, the all the reactive oxygen species and the bad elements which are remaining, that is toxic substances remaining in the muscles, ligaments, and joints, they are relieved because of the physical effort put by the massage. Thereby, you get the relief from the pain. Not only that, by relieving the pain, whatever the organ you are massaging, that improves its efficiency. And penis is not an exception. To keep an erection, best massaging techniques for erectile dysfunction can naturally increase the blood flow to the penis. In fact, masturbation, which has been called as a myth, it is not at all a myth. In fact, it's a very good exercise and it increases the blood supply to the penis every day or alternate days while doing the masturbation. And masturbation itself is a sort of body massage to the penis. One of the erectile dysfunction massage is penis massage. This is massaging the penis gently in order to improve the blood flow, heal the wound, it raises the testosterone level and support the erection. And but the penile massage, when done along with some herbal oil, it further enhances the massage effect by locally increasing the vasculature by the herbal oils. Sensitivity and blood circulation can improve by gently massaging penis with natural oil or lubricant for 10 minutes or so, applying light, moderate pressure. Penis massage for ED can be done through stimulating the tissue and blood vessels in the penis. The massage helps to in relaxation and improves the body's natural reaction to the arousal. So, massaging daily with penile oils, herbal oils is a very good practice. Massaging the penis for erectile dysfunction. A penis massage involves applying light to moderate pressure along the entire length of the penis. Massage for approximately 10 minutes using best oil, the herbal oils, or any lubricant. It improves the erectile function and also it increases sensitivity and increases the blood flow. Prostatic massage. Genital prostatic massage. It involves massaging the prostate. Prostatic may help some men with ED by clearing the prostatic duct and eliminating blocked fluids. That is, in certain cases, when there is BPH, benign prostatic enlargement, and when there is accumulation of toxic substances in the prostate, like prostatitis or prostatic inflammation, removing that unwanted fluid from the prostate itself relieves the prostate, and it may be a treatment for ED also. It may also interrupt infections during prostatic massage. A massager professional lubricates a plastic glove and insert their finger into the rectum until they reach the prostate. Then they press against the prostate to cause it to contract and they excrete the excess fluid known as prostatic secretions. The medical profession may also use these fluid to check the signs of more serious conditions. So alternative managements, apart from the herbals and the sensory focus therapy and psychosexual medicine, there are several the natural techniques without using any medicine to get the erection. That includes penile rings, cock ring, which is applied to the root of the penis. It holds the blood vessels in such a way that erection doesn't come down. The ring applies pressure to the penis and surrounding area to trap the blood in the penis for longer erection. In this way, it helps to maintain the erection. So it's a dummy erection. Instead of the erection coming from the brain, instead of erection coming from the nerves, erection is attained by physical methods by stopping the outflow of the blood and getting the blood trapped into the penis by using the penile rings. And dummy external penile prosthesis can be used for intercourse to satisfy the partner. Of course, the person doesn't get any erection in this one. Penile sleeves also help the partner to get the satisfaction of the person, but in any way, this is not a treatment for the ED. And vacuum pump device. Platelet-rich plasma injection. It's a natural remedy because the warm blood is taken, plasma is separated and injected into the penis. So it can be considered as a natural remedy because no external element or no external medicine is used. Low energy shockwave therapy, acupuncture therapy, vacuum pump, penile rings, vibrator therapy are all alternate treatments available for the management of ED without using any medicine. Vacuum constricted device, popularly called as vacuum pump, is very, very common. Nowadays, it is widely used. It consists of a string ring, a cylinder, and a pump, powered manually or by battery operated. It employs negative pressure to dilate the cavernous venous sinus and increase the perfusion of cavernous artery and venous blood and ultimately achieve the goal of producing penile erection. External constriction ring is placed at the base of the penis to prevent blood flow during the intercourse in order to maintain an erection. But the ring should not be placed for more than half an hour. Otherwise, the blood flow may stop and the edema may occur in the penis or even a gangrene may occur. It is used to promote the recovery of penis function and maintain the penis length also. This is how the vacuum constrictive device works. When the negative suction is applied through the cylinder, the penis enlarges and expands. In addition, device may can also increase the oxygenation of the corpus cavernosa without the use of shrinking ring, that is constrictive ring. This method can bypass limitations of oral drugs and directly achieve an artificial erection, but it requires a normal or intact cavernous nerve to produce an erection. Compared to other penile rehabilitation therapy, vacuum constrictive device therapy is an advantage of being non-invasive or having fewer systemic effects. Acupuncture has been tried and it has been shown to give some amount of success in the people with ED. And it's a Chinese medicine, that is traditional Chinese medicine, this acupuncture. It is an umbrella term for acupuncture, and moxibushi acupuncture is the procedure of inserting filiform needles. Many people doesn't like the needles being inserted into their body, but nowadays patches are available. Acupuncture treatment with patches on the skin, which doesn't include the needles. Acupuncture can control and regulate the flow of Q as well as its distribution and excretion viscera in order to maintain the balance between internal and external environment. And it is said to improve the blood circulation and also increase the nerve sensitivity. And it has been shown that many people with ED get relief from the acupuncture. Low energy shockwave therapy is the latest therapy. It is the only therapy which has been recommended by the European Society of Sexual Medicine and which has passed all the tests required to show that it is effective. and it is being widely used even in our country. And the minimum duration of shockwave therapy is about 9 sittings have to be done. In each sitting, about 1,200 shocks are given, and it is said to improve the erection by neovascularization of the penis and also increase the erectile mechanism by improving the nerve ending sensitivity. This is how the shockwaves are given. Treatment consists of non-invasive, low-intensity sound waves. It doesn't use the electric waves, it uses the sound waves. Electrical stimulation is one of the emerging technology, and it involves low amount of electrical stimulation to the penis also, and it has been shown to give the ED early. Electrical stimulation is also used for ejaculation purposes for people who have got unejaculation, especially when the person has to undergo IUI or IVF for his partner. If the person is unable to give the semen, then electrical stimulation is given to the prostate and penis, and artificial ejaculation is obtained by stimulation by giving a low shock, and the semen is collected. Penile vibrators are also being tried, and it is to some extent it is quite useful for the ED because the nerves get stimulated by the penile vibrators, and using the penile vibrator daily for 3 to 6 months will improve the overall sexual function, and arousal also increases because the vibration increases the blood flow, and any minute clots in the capillaries it get relieved by the vibrators. So vibrator directly and indirectly acts as a treatment for ED. So friends, the most important aspect of the treatment of ED is diagnosis, find out the cause of the diagnosis and treat the cause. Most important treatment is the lifestyle modifications, which includes diet, balanced diet, maintain the functional sexual function, regular exercise, yoga, meditation, get adequate sleep, reduce the stress level by yoga practices, pranayama, kapalbhati, and other asanas to relieve the stress and anxiety, stop or reduce the alcohol, and quit the smoking. So with these lifestyle modification, you can reach 40 to 60% of the EDs can be treated effectively without even giving one tablet of Viagra. So friends, thank you very much for joining me. I sincerely thank the Indus Valley Ayurvedic Center for giving me an opportunity to address such an enlightened audience like you. If there are any questions, I'll be very happy to answer. Over to the moderator. Questions, please. You can type the question or you can unmute yourselves and set the question. Allow the audience to ask questions. Unmute them. No, for them. Yeah. You can type the questions. Yeah, yeah. So if there are no questions, once again, it means that you have understood everything or nothing was useful to you. So both things can happen. And I hope it was useful to you. And I sincerely thank the Indus Valley Ayurvedic Center organizers once again, Dr. Krishna and his team for giving me an opportunity to address you. So in future, I'll be coming out with newer topics concerned with sexual wellness and treatment. Thank you. Shivratri. Good night.